Good afternoon, everyone. We meet today evening for a very important task, which we also need to understand. And this is a mission or a task or an initiative by Ayushman Bharat Digital Mission. Uh, Primarily, we come to know that what is the whole concept about. I've had a word with Mr. Jitendra where they could brief us that what is their aim, of calling all of us on a common platform. So we would be knowing about ABDM. We would also be knowing that how they can incorporate or how we can digitalize our data and make it like a central registry for our patients, and how to incorporate it into the IVF domain. So we have Miss Anita Gupta, who's the manager of ABDM Private Sector Healthcare Adoption, and Mr. Jitendra Kumar, who's the consultant ABDM Private Sector Healthcare Adoption. We welcome you all, and we are eagerly now waiting and to know that what it is all about and how it will benefit us and how we can adopt it. So is Miss
Thank you,
Anita
Shweta.
going to take
Thank
over?
you. So, as people are joining, I just want to just give you a brief background. Uh, we, uh, our conversation goes around 45 days back when we had a first meeting online like this, and that time we decided that we should be contacting the whole Indian bodies. So we should come together. Foxy, ACE, SR should all come together, and then we should work together on this major thrust which Government of India is gonna do through NHA via Deloitte. Uh, so today we are having this meeting in just sensitize everyone. But the part two of meeting, which is a very critical part, Shweta, is that जब बात हुआ था आपसे कि we have got 5 vendors, which Jitendra, am I right? There are 5 different vendors which you had suggested, and there'll be
Ye-
part two
Yes, sir. Yes, sir.
taking it onwards. And I think we'll have we have Renu here, we have got Vicky, we've got Sarappreet, we've got Pranay, embryology and clinical part. We can get a few more members. They can help you in going through those vendors also as you tell us. And before we start, we have with us Dr. Gauri Devi, ma'am. Dr. Gauri Devi, ma'am, is our past president. So, ma'am, good evening to you.
Good evening.
So, would you like to say something, ma'am, before we start? We have got Anita and Jitendra going to lead the meeting. Anything from your side?
Then carry on. Let me understand the thing. Then I'll comment.
Okay. So, over to you. Over to you. Guys, please put the cameras on. We can say hello to each other. It's a good opportunity to say hi, Sarapreet, Neeti, Shalini, Parul, Sabina. Just say hello in case you are up to it, or we can start. So, over to you, Anita.
Dear sir, good afternoon.
Thank you so much, sir. Such a warm welcome to both of us on behalf of NHA. And I must appreciate Dr. Talwar sir that the energy which you have brought, especially to me, that that how keen and how important IVF is, and ABDM adoption can be helpful for IVF change. मतलब अगर मैं शुद्ध हिंदी में बोलूँ ना सर, तो मैंने काफी लोगों से बात की, लेकिन एडॉप्शन के बेनिफिट्स जितने भी सुने आईवीएफ से ज्यादा कहीं पे भी नहीं है. So that is what was very touching for me, and me and Jitendra, and I'll say it's a hard dedication of Jitendra. I have been observed him from last 6 months. He was following up with Dr. Talwar to get some time and give us a little bit things to initiate with ABDM. But sir को जैसे ही पता चला, sir was like, Anita, let's get on the swing and let's make it happen, because ideation बहुत होते हैं but happen नहीं हो पाता. So today, me and Jitendra, on behalf of NHA, will give a just short, brief introduction that actually we are the private partners with NHA, having expertise of strategic consultancy for ABDM adoption all over India in government and private sector. We have a huge team here sitting at NHA, located at the CP location, wherein one team is related to the integration, who help us to provide the multiple integrators related to HMIS, LMIS, and pharmacy, and help them to integrate with as per the compliances of ABDM. So here we have 300 or 333 plus integrated as of now who are ABDM compliant for HMIs, LMIs, and pharmacy. Right now, we will just share what is ABDM, and maybe I can ask a small question. How many of us know about ABDM? That is Ayushman Bharat Digital Mission, not Ayushman Bharat PMJY, Pradhan Mantri Jan Arogya Yojana, not that one, but ABDM Digital Mission. Anyone?
I think it's basically, can you hear me?
Yes, please.
Yeah, I think basically the government wants that there should be one unique identification which should be linked in all sorts of places for one patient. Something like that.
Yes, absolutely. Almost touching the line. Yes, it's related to the unique identification of a patient having all its digital health record being linked. That is ABDM.
Yes.
And today we are here actually to give the overview of that how ABDM adoption can be done at the various clinics associated with IFS, and what benefits professionals will get while giving the quality care to the patient while having the IVF treatment. Right. So I'll just start with the benefit, and also during the course of the presentation we will share it with everyone. The objective of calling everyone together is that first, why we are adopting ABDM, right? What benefit do I get? So we are here to explain those factors first, and the next step, how we will get enabled ABDM clinics, right? So for that, sir has mentioned that IFS is planning to have a committee, and some of the committee members are already here, who will help us to have an ABDM compliant application, which will be rolled out in all the clinics, and which all clinics associated with IFS will be on the first thing, that they will have a common application which will rolled out in all the clinics, right? So these two steps we will be focusing upon today, that how we will get ABDM enabled solution for all the clinics, and how the benefit will actually support the doctor as well as the patient for giving the quality care to, and ease the things basically, right? So next slide, Jitendra. Jitendra, can you, if in the start, if you can, Jitendra will be the first point of contact. So most of us, more than me, I think so everybody knows Jitendra. So I'll ask Jitendra to give, brief introduction about himself.
Okay. Thank you, Anita. And thank you, sir, Pankaj, sir, and for having this session. And yeah, it's been 6 months. I've been chasing you for this moment and for this webinar. Actually, my name is Jitendra. I am from private sector healthcare, private sector healthcare expansion, and I'm looking after the adoption of ABDM in private sector, facilities and hospitals. So we are also looking for specific kind of domain also, like this is a specific IVF domain. So we are trying our best, like how can we support this domain, IVF domain, and make their operations very efficient, how we can make their operations digitalize, also how can we make ease of operations, and also how can we reduce time in the all your manual processes, and how we can make all the processes, yeah, maybe your lab testing of lab samples, everything real time, and you can track all the things. Like we are not sure how the things are happening right now, so but in future we are thinking a digital IVF domain which are totally digitized in the ABDM ecosystem, with real time tracking, and with all the digital health records in the hands
Sharing
of
of the
patients.
records. Yeah, sharing, linking the records.
So yes, Anita.
Yeah, I was saying for sharing and linking of the health records.
Yeah, sure. That we can, with the sharing, with the consent, obviously with the consent of patients, and also the the best the doctors and the health professional would be get advantage of their history of patients and getting the right treatment to the patient. So with this thing in mind, we can start this session. Over to you, Anita. Thank you so much.
Okay, thank you so much. Thank you so much, Jitendra. Lovely introduction about yourself and vision of why we are here today. Yes. So about the vision, I'll say I'll not go more technology perspective here, but I'll say that this is an trusted ecosystem which has been defined actually to create a national digital health ecosystem. When I say ecosystem, we are covering the entire care of care of continuum whenever a patient comes and exit out from the treatment, right? So we cover that entire thing as a universal health coverage for efficient, accessible, inclusive, and affordable, plus time and safe manner. When I say safe manner, it's entirely digital. So we think which kind of technology, how the sharing of things is there, which kind of source or the platforms we are using for exchange of the data, right? So there is a set of defined policy against which the entire visions of the ABDM has been defined under Ministry of Health and Family Welfare, wherein the way Aadhaar is mandatory, but ABDM participation is absolutely volunteer. For anybody to create Aadhaar ID, that is also a volunteer, right? The whole objective is that if you get digitized, the benefit is directly to you. So it is a volunteer participation, whether you want to avail those benefits or not. So the entire vision has been, and the technology which has been used, it is defined on a certain policy defined under Government of India. And the technology stack which has been taken is a single source of truth on which Ministry of IT is the core participants for developing ABDM ecosystem. Now it's a federated architecture. When I say it's a federated architecture, it means that suppose we are on a bridge of A side and the B side, there is a bridge. That bridge is ABDM ecosystem. So one provider and another provider can exchange the data only based on the consent of the patient being given or the doctor being asked. So the entire protocol of requesting to a patient, asking from a patient for giving the consent, and then sharing of the record between two different providers can easily happen with an ABDM compliant application, which says it's an open source and a federated architecture for exchange of the information between the patient and health facility. Next, whatever APIs and things we are using it, all are interoperable. That is, it is available only a certain set of standard protocols we have to follow to have that integration done. As I mentioned, there are two teams working at NHA. One is for adoption, another is for ABDM integration. Right, so there is an integration team which enables all the HMIs, LMIS provider to get ABDM compliant under the technology stack which has been developed for developing the ABDM ecosystem. It has defined set of standard frameworks. Everybody might have heard of DPDP Act, which was launched last year, but now this architecture was already defined previously that it is a DPDP Act compliant application wherein the exchange of records is only based upon the consent of the patient being given, and the exchange of information from one source to another source is absolutely secure. So the trust of the data is there, that nobody is going to take away anybody's data unless and until there is a consent given by the patient to the doctor. And doctor can also request, is a proper protocol. The doctor also requests on certain limited HI types. When I say HI type, they are the health information data. And now health information data are overall 7 to 8, which includes like your prescription, lab reports, wellness report, vaccination report, and 2-3 more types, wherein the doctor can specifically request which HI type doctor want to see while giving the treatment. So even limitation of sharing of the data respective to the HI type is defined in this framework. So this entire the policy and the technology stack is built upon a core building blocks of ABDM ecosystem, which says first is Aadhaar number, health facility register, health professional registry, unified health interface, and Aadhaar app. Quickly, I'll summarize Aadhaar number. As I mentioned, it's a unique identification number for every patient, whoever visit to a clinic. Then only he will first entry point to ABDM ecosystem is to have the Aadhaar ID. Now, health facility register is the basically source of truth for ABDM for whatever facilities is there, which is linking the records, it should be registered under HFR. We say that it should be registered as a facility in ABDM ecosystem. Vice versa, the professionals who are ABDM using the ABDM compliant application should also be part of the health professionals registry. The way we have registry while doing our medical certification, this is one source of truth, that you have a valid registry of wherever, if any you have a proper certificate issued by NHA. Once you get registered, post verification of your records, you will get a valid registration number as a HPID, we say, and against your facility also you will get a HFR ID. So entry into the ecosystem, you should have your HFR ID, HPID as well. Now, what is health interface, UHI, we say? Once you come into this ecosystem, in short, I'll say, if any patient, you are registered into this ecosystem on the UHI platform, if any patient want to see that, which is in the nearest IVF center, your center will get the preference and you will be visible against his request that, yes, this IVF facility is available, you can go and avail the services. That is the benefit once you come into the ecosystem of ABDM. And ABHA app is the basically an PHR app, we say it. PHR app is just like your mobile phone, any application wherein the records of the patient can easily be linked to ABHA ID. And the way you see your bank transactions, in the same way you can see your health records as a transaction, that wherever you go, your clinics will write an EMR that will get linked to your, ABHA ID, and you can see at any point of time which where is my prescription. You can share that prescription to the lab and say that these tests I need to do. You need not carry your paper along with you. The lab can access your ABHA from your ABHA ID, they can access your prescription and see which all tests the doctor has written, and they can directly conduct the test. After conducting the reports are available, that also get automatically linked to your PHR app. So the doctor can directly ask, and give me your consent, I'll see your report. So you need not even carry your reports to the doctor. If you have taken the test, you can call and say the doctor that I've got my report. The doctor can request you, please give me consent of these reports to view, and the doctor can view this thing. So this sounds simple, but is actually simple. That, if suppose Jitendra goes and say to Safdarjung Hospital that, I have taken Anita prescription, I can ask Jitendra to share its record as well. So he can share it through the phone also to that, yes, I have visited. It is so easy. That only thing is that we have to get an ABDM compliant application wherein all these things are accumulated to a single ABHA ID. Now, these are some of the key points which we wanted to highlight, that why ABDM vision is we are explaining. Next, Ajitendra. This simple example, I'll say, earlier when you used to go to grocery shop, you used to give, 10 rupees or something like that to take anything. Now we go and we scan a QR code and say, now we have got our item, please take the money. We did not pay, any hard cash to them. We just digitally pay. In the same way, when we visit a clinic, I did not take my papers along with me. I can show in my PHR app that I have my records in my hand. Just see this. The doctor can easily see this. Next. These are some of the key stats that, more than half of the population of India is already having the ABHA ID, which has been created, and approximately 60 crore ABHA linkage has been done. And, 4 lakh plus health facilities are already registered, and professionals are also there. Now we are targeting maximum IVF domain professionals to get integrated on ABDM ecosystem, that, your professional details are available to whoever wants to take the services of IVF. We want IVF professional to come under UHI and, populate their clinic data that, yes, these are the services which we provided. These are some of the integrators which are there. As I told you, 330 integrators are already there. And, many are there in pipeline. You can see which are there in process of, getting ABDM enabled. So these are some of the private players, government players, and, programs which has been integrated with ABDM ecosystem. Next. In short, sir, we will come to a point that, why I am emphasizing on ABDM adoption is that in IVF, what happens when we give treatment to, patient, therein we need record of the patient that, how many trials has been taken, what kind of treatment, which kind of, sperms have been already taken into consideration. What was his clinical history? So I have observed and cases we have seen, as I told you, we are working from last 6 to 8 months on this area, and we have seen many challenges that, people are hesitant in sharing their data. Somewhere doctors are not having the clear information of the actual treatment that has been given, the referral hospital from where the earlier this patient has already taken the treatment. So such type of treatment, correct information, helps the doctors to basically understand, which next step should be beneficial to the beneficiary while giving the, success rate under this. So certain things which we feel, instead of, a patient explains to them, it's better to see the the clinical records of the patient and directly go on the conclusion point of view. In fact, we can share with the, seniors that, this is a consultation, should we go for this treatment or not? Such kind of thing only happens when we have the right source of the data for, when we are leading in IVF. So this is one of the factor which, made us to push to go towards, more inclined towards IVF, that this is a domain wherein actual what the patient history is makes a more relatable treatment to them. Otherwise, what happens, sometimes people hide key why we have to, tell everything. Otherwise, they will go into more detail. So considering that this kind of challenges, we thought we should speak to IVF. We spoke to many IVF professionals, and they said one of the best benefit that we identify in ABDM adoption is that we have clear-cut information of the patient's treatment, the medication, the clinics which they have gone, which kind of doctors and all. So that will give a brief history about the actual treatment that the patient has taken. So this is all about the benefit that I wanted to share with everyone here, that, ABDM can help to have a past history of the patient and help you to give a quality care. And second, that, your confidence level by treating, that success rate will be higher, will increase, will be more than, earlier. So now the next step, which I think is that how you will get into this ecosystem, is that this is one of the integration process which I mentioned, that 330 plus integrators have already gone through and they are ABDM enabled. We have spoken to, Dr. Talwar, that we have identified, we have done the homework, and we have actually identified 2-3 good LMIS solutions which are there, and they are actually working in IVF domain, right? So like Indrani IVF is there. There are many chains are there who have already onboarded ABDM ecosystem, and yes, they spoke about it. And there are other clinic also. Recently, even Nova Clinic also has approached us that they want to have ABDM awareness and, they want to adopt it. And please help us to have a right source of, LMIS solution, which can help us to overall, relate the things and bind our entire clinics together. Right. So that is the whole point here. So the steps which here basically explains to the integrator. Suppose in case you are having an LMIS system and you don't want to change your LMIS, that is also easy. You can ask them to get onto our sandbox server, and we will register their application. It takes hardly 2 to 3 to maximum 4 months of time to become entire M1, M2, and M3 compliant. Now, what does this milestone 1, 2, and 3? In fact, now 4 is also there. But for IVF, these 3 are important. That M1, basically, a patient visits your center. It creates your ABHA ID, right? So that is your milestone, that any patient who visit will not exit your clinic unless it has ABHA ID. Second, when an ABHA ID gets created, the first registration, the prescription which you write it, the medication you write it, that entire digital record gets linked to the ABHA ID. So that is the milestone 2, right? And the third milestone is that once your ABHA creation, ABHA linkage has happened, the third step is whenever within clinic, if the doctor suggests, please go to another clinic of, same, suppose they are also using the same LMIS or different LMIS, but they are ABDM enabled. So they can exchange the records without, having the hard copy or anything. They will just request the patient, please share this document to so-and-so doctor. Doctor will raise the request. The patient will get a pop-up, just like, Paytm, कि आपने ये ट्रांजैक्शन किया है तो आपको पॉपअप आता है. वैसे ही किसी ने ट्रांजैक्शन रेज करी है तो आपको पॉपअप आएगा. You have to just approve that, grant the access, see that which documents they are asking, just click on those documents and give granted. Automatically, they will be able to view it. It is so easy. So that is what M3 means. And yes, as I mentioned, there is certain set of standard protocols that has to be, followed to get it enabled. It is just because that we want to have in a secure system of, creating, linking and sharing of the records between the professionals based upon obviously consent of only and only the patient. The patient should be comfortable while sharing of the data. Second thing, we have found many doctors have hesitant that, our records will get shared with government. It's nothing like that. It's completely a DPDP Act compliant application. Now the rule has come, but earlier, last 2 years back only, this application was DPDP compliant, that no document can be exchanged or shared with anyone unless and until it is being provided by the, tech provider and shared based on the consent of the related patient or the professional. So this is all about, this is a brief introduction about IVF clinic. I'll say when we were, getting into this domain of understanding, we created what ABDM basically aims for IVF, which I have mentioned most of the points in earlier slide. We can skip to the next slide, Jitin. Yes, these are the key challenges that we spoke about. That, data privacy and the security concerns are always there with the professional as well as with the patients. But yes, I told you this is completely M3, which says that you will be M3 only when you are, completed M3 milestone. And in short, I'll say there are 4 level of checks in NHA. A team is there, which, we say FT means functional testing they have to pass. Then there is HTC team. There is a VASA certification. It means that there are certain in under Ministry of IT security audit people are there. Your application, whatever you are using, should be VASA certified. We say that it has to comply all the security checks. Then only they will cross. Third and last is the STT one, wherein there is a committee, health technical committee, which evaluate the entire application of, from security, from testing point of view. All these reports are success. Then only the HTC committee is there, which clear the application that yes, this application is ready to deploy. So all that concerns of data privacy, security, basically you can just, ensure that whatever data is being created, linked and shared, it is safe under ABDM ecosystem. So this is basically a flow that we have plotted at how does, the overall patient journey works when it enters into a clinic, that it goes for ABHA registration and it books his appointment. Its visit is created, the doctor, the consultation, records get generated. If required, lab reports are also linked to that. And accordingly, doctors can view those records and, proceed for the required procedure, which has to be given. Based on that, treatment is given, medication is given. It can easily be written down in their PHR app, and they can show to the pharmacy that, yes, I need this medication. And therein you can, and the best part is that, ABDM ecosystem in NXCX enabled as well, wherein, claim process also works. So if you have benefit of IVF treatment under your insurance, that also get the entire record linkage is also there, wherein you can share your records with the insurance claim company for, required claim amount which need to be drawn. Next, this is the objective that we want to increase the adoption and utilization of ABDM enabled applications. And yes, after this call with the committee members, we can inform the ABDM enabled HMIs and LMIS providers who can help the, IFS team to select and, roll out those entire, whatever clinics they want to enable it with, about, the ABDM ecosystem in their respective chain, I can say. Right. And yes, the benefit I've explained that is very comprehensive and, user friendly, and sharing of records is safe, and it's very private, respective patient and the professional who are using this. So all these things, I'll say about art, I need not speak much because more than me, you guys are expert into it. So obviously they are the governing body, and we do consider those factors. If we're talking about ABDM, that yes, one of the four areas will be that adoption of IBM is important for. These are some of the governing body understanding that we have curated in this slide. That how does the overall art, national art works under state and state authorities, and how it goes to district. And yes, Dr. Talwar has helped supported us, to follow this hierarchy, actually to push the things at the ground level, because involvement of authorities are necessary when we are bringing something new into the system. So that is what here. Next. These are some of the cases that we have observed. We wanted to present it here, that such cases can be avoided if we have IVF enabled system, like unique identification of every information, every beneficiary is given, and we have to just integrate it with an ABDM ecosystem, and such things can be avoided. That we have heard of sperm mixing, and it was a huge case out of it. Then many patients have a concern that why your records are being shared with doctors. XYZ reasons are there, but we wanted to focus now. This ecosystem helps so based on consent only, and it is limited to the patient, not by the professional. Next. This is one of the partners which I mentioned in the beginning, that they are using it, and they have good responses. We wanted to include one of the partners, but somehow they did not join this call because of unavailability. But we were thinking to bring someone to speak about the benefits of ABDM adoption. These are some of the key benefits which have less or more covered overall, and that what are the points that as a patient they get it, and as a clinic and health professionals running our own clinics get the benefit of sharing of the records, requesting the patient, and getting the truth. I can say that no curation of the content is there in that. And what are the DSCs? I'll say integrators. Yes, our team is here to help you in every prospect. If you need a new integrators who can support in specific to IVF, yes, we have identified with the homework. We will help it. In case you have any other LMIS which is working in your clinics or the hospitals, you can just let us know. We will guide end-to-end, start to end procedure for getting them ABDM enabled. We dedicatedly form a team, IT team of the integrator, IT team of the NHA, and we will be there as a moderator who ensure that end-to-end communications are there and the end objective of clinic onboarding is achieved. Not only that product gets ABDM enabled and we have gone. No, we are here for bringing in solution, for adopting that solution and making it running. ऐसा नहीं है कि प्रोडक्ट आया इंस्टॉल कर लिया खत्म. वी कीप फॉलोइंग. प्रोडक्ट आ गया, इंस्टॉल हो गया और सब्सक्रिप्शन भी हो गया, तो फिर वो चल क्यों दे रहा है? If there is a lack of capacity building or the training, we ensure as per the request of the clinics, we do conduct regular webinars with all the respective clinics and users. Whoever you want it, we can introduce the entire system. Next. So this is all about IVF adoption that we are looking for in ABDM or vice versa. Over to you, everyone. We are welcome with your questions. You have any query, you can please ask us.
Dr. Amita, this is Dr. Gauri.
Yeah, good evening, ma'am.
Good evening. I was wanting to know that can you get all this stuff in a website or something, because it is too much for us to understand in 15 minutes, whatever you try to tell us.
Right. Ma'am, I think so, Dr. Gauri, if you are there in our group, we have already published this PPT presentation deck, and yeah, this deck is there in the group. Apart from that, if you need the ABDM website, that link we will share it.
Dr. Gauri ma'am, the PPT is in the board of directors group. We have put the
Okay.
PPT there, and for all other
Okay,
people,
okay.
all our esteemed guests here, and all our executive members, and
And is there any website or something, Doctor?
any website, Anita, will
Uh,
be
Yeah.
yes, sir. मैं website का link share कर दूँ. I will share on the group.
and this PPT will be sharing after this meeting. For board of directors, Dr. KD Nair is here, and ma'am is already there. For other members, we'll be sharing this PPT with permission of Anita and Jitendra after this meeting gets over. It will be mailed to every one of us. Dr. KD Nair, sir, you are there. Would you like to say something, Dr. KD Nair? Or anyone can?
मैं आती हूँ बच्चे लोग.
Pankaj,
KD sir, Hanji sir.
you see, I was listening, but how they are still not very clear. They are going to make it online, and all the medical records will be made online, and then only it can be shared. Isn't it? That is what I understood. The medical records of the patient has to be made available online.
Sir,
Anita?
sir, can I answer?
Yeah, yeah.
Yes, sir. Of course, ma'am.
Yes. Sir, in simple, I'll say you have Aadhaar number.
Yeah.
Yes. Your Aadhaar number is linked to your bank account, right? Now, in a ICICI bank, which I use it, ICICI bank, if once my Aadhaar number and bank account is linked, and all my transactions in that mobile app, I see it. I have
Okay.
unique bank account number as well. Against that unique account number, I have all the transactions.
Yeah, I understand. It's a
In
bank
the same way, sir,
That
ABHA
is
ID is
what I'm
also
asking.
there.
That we have to first upload this patient document, isn't it?
Yes.
We have to
First, you
upload
have
this
to
patient.
create an electronic medical record
Yeah, we have to
Yeah.
create an
in an
electronic record.
application.
Only
That
then we can
application
use
will
it.
automatically link that EMR to the ABHA ID.
Yeah, I agree. That is what I'm saying. We have to create an electronic medical record.
Yes.
KD sir,
We have the new law and all this thing. Still, our records, our data has not been made online. It will take years. And for making this electronic medical record, I don't know how much time it will take.
KD sir, just button here, sir.
Yeah.
They are also engaging us in a parallel way. There are 5 companies have been shortlisted, sir. And I think Jitendra can speak about that. The part 2 of this meeting, as I've already posted everywhere, will be we are making a board of members, which will have around 6 members from our end, sir. They'll be reviewing every company when they come with their elements. Am I right, Jitendra? That's a plan we have starting from this weekend. And five
Yes,
companies
sir.
are there, sir, which will be shortlisted, and then we will take it forward. This job they've given it to us.
Yeah, that I agree. But first we have to be very clear in our mind that we have to make electronic medical record, which has to be uploaded.
Yes, sir.
Problem is to teach our members how to make the records and how to upload. Even this very simple fact of adding your Aadhaar card to your bank account. Till date, only still many people have still not done it.
Like Digi Yatra, which you
Yeah,
keep
you
telling me
understand?
every time. I know.
Still many people have not done it. Didi is
Sir,
a
कोई कोशिश
very
कर
good
रहे हैं,
example.
actually what I
We
have told.
travel every week, but many of people have still not done it.
हाँ जी सर, तो मैंने सर ये बात उनको बोली थी
हाँ.
that we will make some model and nodal centers in Delhi NCR, probably other parts of the. So we'll be engaging after we have everyone's blessings. We can't do it in case you all agree. We can engage with the government of India. Then we'll have some zones like Delhi or Gurugram or some other places where we'll engage CMO and the ART board. And then we'll have some model centers from where we will start experimenting the LMS. And after around 7 8 months, it can be adopted by other members in case we have permission.
You see, it is a good initiative, but it is all, you have to have some time-bound affair. It cannot go on and on for years and years. Like,
Yes.
I'm being very clear, with the AIT board, AIT law has been made, all the data was supposed to be online is still not online.
Not online.
And it will be, say, another few years when it will be online.
Absolutely, sir. Anita,
So
what is
similarly,
that?
the project, if we don't create electronic medical records and put it online, nothing will happen.
Very right,
Only
sir.
you and me will exchange our mobile.
Very right, sir. Anita, from your side, what is the deadline? We are ready.
You have to fix some deadline.
To do it later after. Over to you now, Jitendra and you.
Yeah. Sir, I always think if I need a change, the change should start from myself first. So the change which I want to change myself first is that instead of paper, I want that in next 1 month or 2 months, I'll be completely EMR clinic. No record will be created on paper. In fact, sir, you won't believe we have some hospitals wherein they have just removed the inventory for dispatching printout papers. वो जो पहले A4 साइज का सर स्पाइरल आता था ना सर, उन्होंने लेना ही बंद कर दिया कि जब देना ही नहीं है प्रिंट आउट प्रिस्क्रिप्शन देने के लिए तो मुझे स्पाइरल का इन्वेंटरी क्यों लाना है. दैट इज द एम सर. In the same way, sir, we want, with support of Dr. Talwar, that soon we get a good LMIS and HMIS in all the clinics being rolled out, and we want all the practitioners to create their EMR. That is we think, sir. That is what we want. And sir, as Jitendra, we have identified and shared the links also with you that these are the available partners. And of course, sir, for you to evaluate everyone may be challenging. So we have identified and sorted out that out of 300, a list of 10 who are focused specifically in IVF, 2-3 remain. Although, sir, LMIs in and out, sir, सारे एक जैसे ही होते हैं. बट कुछ LMI जो IVF में काम कर चुके होते हैं तो they understand the terminology much better and they understand what can be the ask and they can even go for little bit of customization. So we have identified 2-3 vendors, those who have already worked and willing to customize their product and deploy. So we are also ready with our homework. So that's why yesterday I think so I wrote a message that sir, let me know and introduce wherever webinars are there, because awareness is the success of this, sir. The practitioner will call us, Anita, help us with this. We will connect them and the provider will go and, kickstart the journey. It hardly takes, sir, 1 घंटे का काम है. ऑनलाइन वो आपको देखा, आप रजिस्ट्रेशन करिए, उसके प्लान को सब्सक्राइब कर दीजिए, उसका ब्रिज आईडी मैप कर दीजिए और EMR स्टार्ट कर दीजिए. कोई ज्यादा टाइम नहीं है सर इसमें.
Let us start. Let us see how to create this EMR, electronic medical record. Number one.
Yes, sir. It is, sir. जैसा मैं कह रही हूँ वैसा है भी सर. ऐसा नहीं हम दूर कह रहे हैं. But only thing is that वो onboarding का integrator और उसके application को roll out कराना with certain set of capacity building which takes certain time. Right. और वो सर if we pick up 10 clinics की इन 10 को हमें next 1 month के अंदर पूरा digitally enable कर देना है तो it can easily happen.
This is my idea of joining this webinar. I was thinking probably you are going to give us some information that IVF procedure can be covered under Ayushman Bharat. There is how IVF procedure can be covered under Ayushman Bharat. Is there any possibility?
Under PMJY scheme you're talking about, I think so.
Yeah.
PMJY scheme, sir, you're talking about?
No, this IVF procedure, whether it is covered under what you are doing is Ayushman Bharat online record. That
right.
is what you are doing. But you are not giving the coverage, the medical part, the expenses part for this. Where it
IVF treatment, right? I think so, sir. मैं अभी इतना sure नहीं. It's a policy level understanding. I think so. I have to check that. And as per now, so sir, I think so. It's not covered.
Yeah. So basically, you are doing is you are doing an electronic medical record, creating them, uploading them, and telling us to follow it on my online.
Sir, actually, the thing is that the objective of introducing this is basically to ease the quality of care that we want to give it to
Okay,
patients.
I understood. This
Sir,
is
आप लोग का भी जो एक जो procedure होता है, it's not that easy. There are a lot of things which we get because of miscommunication we lag it. तो उस चीजों को ओवरकम करने के डिजिटाइजेशन इज द राइट पाथ व्हिच आई फेल्ट कि एटलीस्ट वो जो डायरेक्शन होती है वो तो मिल जाए, डिसीजन मेकिंग है वो तो मिल जाए. रिस सर, आप लोग का जो ओवरऑल जो ट्रीटमेंट है दैट कैन नॉट बी कवर्ड इन डिजिटाइजेशन पार्ट. आई कैन से दैट.
Thank you for clearing.
I think, sir, we'll if you permit us, we can move ahead, sir, with this program, sir. Gauri ma'am and Dr. KD sir, you're a board of directors. Sureen was around.
Yeah, we have to create a awareness how to create the electronic medical record. Number one. Then number two, how to upload it on the system and how it should be integrated so that we can retrieve it. That is what you need.
Yes, sir. Yes, sir. So I think, thank you so much. I think we'll invite anyone to come and speak. Any one of you can say hello and speak. You can share your thoughts.
Dr.
Dr. Sir,
Pankaj sir, can I ask a question,
yes,
sir?
Niti ma'am. Yes, Niti ma'am. आप बोलिए ना, please.
Sir, even I had this thing in mind what Dr. KD Nair sir was saying, that this Ayushman Bharat digital, this thing has nothing to do with the Ayushman Bharat, the
That
actual.
Pradhan Mantri Yojana is different, madam. This is a
Okay.
different digital mission.
But
This is
this is
a
a government, this is also a government of India
yes,
initiative, right?
yes, ma'am. Yes, ma'am.
To
Yeah,
digitalize
ma'am.
healthcare. It is a
Yes,
government
ma'am.
of India initiative to digitalize healthcare.
Yes.
And Miss Anita is talking about digitalizing IVF. This is
I
what
agree.
I
जी
understood.
मैम, जी, absolutely.
ठीक है सर,
प्रधानमंत्री
ठीक है.
योजना नहीं आई. It's not PMJ. That is not प्रधानमंत्री योजना.
Yes, sir. May I just, sir,
Okay.
I will take only 1-2 minutes. I will just, actually, NHA is an apex body. It's a part of MOHFW, Ministry of Health and Family Welfare. And NHA, National Health Authority, is handling two missions. Like first, they have given this PMJY, Pradhan Mantri Jan Arogya Yojana, which is an insurance scheme of 5 lakhs. So we, NHA handled that successfully. And after that, this is a new mission, Ayushman Bharat, digital mission. This is not an insurance scheme. This is a vision to digitalize the health ecosystem of India. It's nothing related to insurance or anything. PMJY, that's an insurance scheme, and this is a different scheme. This is just a digitalization to strong and strengthen our digital health system. So this is the vision of this ABDM. It's a totally different from PMJY. Yeah.
Thank you, Mr. Jitendra.
Thank you.
Thank you. I got it. Thank you.
You see, Jitendra, like you say, it is a
Yes, sir.
Ayushman Bharat the scheme.
Yeah. Yes.
Our minister, Delhi government minister is living next door to me. So his staff called me and they made me one this card, Ayushman Bharat ABBA card. Number is there, my photograph is there. I really don't know what is the implication of this card. Where I can use it? How I can use this card?
सर
Sir,
देखिए वो
there
कार्ड
are two cards. It's a media.
I thought I'll
take
show
up
you the card. I'm carrying it in my purse. I thought maybe it will help me everywhere. This is the card. You can see it. And
This
this
is
is
the
the
ABBA
name
card.
which you are saying, isn't it? This is the Ayushman.
This Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. Or
This is something different than what you were talking.
नहीं सर आप थोड़ा कार्ड क्लियरली दिखाएंगे
हाँ थोड़ा सा ऊपर दिख नहीं रहा, थोड़ा ऊपर करेंगे सर. हाँ
ये देखिए
सर, ये PMJY का ही है.
PMJY है दिल्ली में सर 5+5 वाला जो मिला है ये वो है सर.
वो है
जो 5+5 lakhs, जो 10
So
lakhs का जो.
we are confused. We have so many
नहीं,
Ayushman Bharat, so many this.
सर मैं वही क्लैरिटी दे रहा हूँ सर कि PMJY is a different thing which is an insurance scheme, और ABDM is a totally different thing.
This is a digital program, sir.
That is, now we are clear. That
Yeah.
ABDM is something totally different.
Fantastic. So I think we'll invite everyone to say something.
Can I ask one question, sir?
Please ask. Over to you.
So Anita ji, tell me that you will be, after we enroll or register for ABHA card, then you will help us. We will have to enter the data ourselves. You have that proformas and everything made where the format is made. Somebody will have to enter the data and all.
You will be making it. You all will be making the form.
Yeah.
Forms have to be made.
We have to make
I've spoken to you 2 days
the
back.
format.
I've spoken to you 2 days back. We've
Yeah,
taken
yeah,
the
yeah.
numbers. So that's the same forms. They have got some vendors on road.
Okay.
I had requested them that we should all sit down. Foxy, ACE, ISAR, IFS, sit down together and put our minds. We'll have some members from our side and the whole country sits down together. We'll also get some government machineries to come down and you'll be part of it so that we can actually make the right forms and formats. This is yet to come.
Okay.
And we all will be part of creating that form.
So, sir, this will be free for all the institutes, or only for government institutes or what?
Everyone, everyone. What you
Every.
say? It's free for all. That's what I understand. It's a government initiative.
Uh,
What do you pay for that?
So,
so
when we talk of other big institutes like, like Apollo Hospital, so is it, the hospital administration has to be involved. It's not like a small thing. You can't have a thing for a small department. Will other specialities will also have it, or is just for IVF you're creating like this kind of a
IVF,
thing?
only for IVF.
Only for IVF. I mean, because, Ayushman Bharat doesn't cover IVF as such.
This is for
but
IVF now.
It's
This
just
is
for
only for
IVF.
IVF. Yes, for IVF.
And
The
because
IVF
it has to go through the proper channel. It has
Yeah.
to be implemented in the hospital.
NH is part of
As a
government.
part of, not
NH
like
is
a
part
small
of
thing.
government. The government will finally give the directions. We are not
To
like
then all the hospitals, yeah.
Yeah, that's from government of India. Ministry से आएगा चिट्ठी आएगा.
So, sir, in the beginning, we will write a letter to the MS of the hospital of our institutes, government institute, that we are involved in this and we are helping the AHA to develop the proforma, and we will be very happy to use the EMR for the IVF facility. Something like that. Because we have to go through proper channel in the institute.
Absolutely.
And if we are involved in anything like this, we will have to inform them and take permission from them.
Anita.
Sir, yes. Sir, ma'am, I'll answer, add to what sir said. Sir said, what will be the, system which will help you to integrate, right? And now you want, suppose if I ask Dr. Saxena to enter into ABDM ecosystem, the first step in the initial side, which I mentioned, you should have your ABBA ID, which is easily available online. Sir, ma'am, if you write it, creation of ABBA ID, it will automatically direct you to the ABDM page. You can first create your ABBA ID. Second, you have to you are a professional, health professional. You have to get yourself registered in HP health professional registry, which I mentioned, right? That all the verified source of health professionals are registered in ABDM ecosystem. That yes, they are the verified source of truth. Suppose we want to know how many IVF professionals are there, Dr. Talwar can write it to NHA, and see that give me all the IVF professional under IFS. I want to see it. So we can share it. Foxy can also share it. ISAR can also request and take it. But we want all the professionals under IFS to register themselves first and enter into the ABM ecosystem. And then your facility also gets registered. And that facility will be linked to ABDM ecosystem for exchange and linking of the record via bridge ID. And that bridge ID will be of the provider. Provider, I say, it means it's a LMIS or the HMIS provider, which will help you to digitize your entire clinic. Got it, ma'am?
So it will be my institute which will be registered. Basically,
पहले
one
आप
person.
अपने आप को इकोसिस्टम में इंट्रोड्यूस करिए विथ योर HP ID, फिर आप अपनी फैसिलिटी को लाइए और आपकी फैसिलिटी को डिजिटाइज जो करेगा वो आपका एक सोल्यूशन प्रोवाइडर होगा और
तो
वो प्रोवाइडर
फैसिलिटी को डिजिटलाइज करने के लिए आई विल हैव टू टेक परमिशन थ्रू द एडमिनिस्ट्रेटिव हेड्स एंड ऑल ना.
Yes. Now when I say administrative head, Dr. Talwar and we are discussing, we have identified certain vendors which sir has mentioned. They will speak to them and they will roll out into the clinics. That this particular provider, we will roll it out in all the IFS clinics, and then we can have a uniformity of using either a single provider, or if anybody suggests no, I want to go with particular LMIS provider, they can do that also. But yes, they should be ABDM enabled.
So what about places who already have an EMR? Like, our hospital already has an EMR. I'm just thinking practically it'll be very difficult to, suppose the patient comes to the OPD, do it in two separate EMRs, the same data. It's quite a cumbersome process. Like one EMR is okay.
Don't even think that, if your existing LMIs need to be replaced with a new one. Of course, no. If you're comfortable using your LMIS system, just ask them to get into ABDM ecosystem registered. We will enable them with all the milestone M1, M2, M3. हम उनको ABDM enabled कर देंगे. That's it. We did not change it. But जहाँ पर कोई
at the same time will be too cumbersome. I mean, I'm just thinking like that.
Yeah, that's what I'm saying. If you're comfortable going already having an LMIS demand that's working fine, then no need to change, right?
Yeah.
But we have observed that some of the LMIs doesn't work properly, and because of that, people don't do EMR part at all. चलती नहीं है चीजें, एरर आती रहती, तो ऑब्वियसली वो बंदा
Still,
पेपर उठाएगा और लिख देगा.
Technical issues, yes.
Yes. तो वो सब issues को we will think में यार better provider ले लेते हैं, which will help us to run the things smoothly. So we provide that support also. We will provide you a guidance that these are the providers. Please reach them, because आप लोग के लिए ढूंढना, search करना, substitute लाना is difficult task. We understand. So we will help you in that stage. That get yourself digitized. We are
We
here
can
for
actually
that.
tell the hospital administration to get themselves enrolled with your program,
Yeah.
because you already have an EMR.
Yes.
So yeah,
the way you said administration has to bring them on board to ecosystem. They have to tell, if you want to work in my institution, you have to first get ABDM enabled. Bus. Rest the homework is me and the provider.
Mr. Jitendra, is it free or will it incur a cost to the center?
Sam, it depend करता है. There are different vendors.
I'll answer to this. I'll answer
Okay.
Dr. Shweta if I can.
Yeah.
Ma'am, there are providers who give the services for the initial few months as a free, but after that it's chargeable. And right now government is also taking certain initiatives wherein there are subsidized rates for having an HMIS and LMIS solutions, and soon we are going to bring one of such product which is at a very subsidized rate when compared to a private sector, right? When I speak about private sector, there are providers who have monthly subscription charges which are there, and that we can discuss with Dr. Talwar, that along with the providers. But yes, when you have asked, it's for free right now, ma'am. It's not free. The solution companies are not giving free of cost the HMS and LMIS. But yes, there are certain HMIs which are going to soon come in the market, which will be provided by NHA at a very, very subsidized rates.
Will it be compulsory for all centers to enroll in this mission? Because
so that Dr. Talwar can say.
Unless the government makes it mandatory, no one enters into any program. Okay, like PNDT and the ART National Registry made it compulsory that every month you have to send a particular data, and then every year yearly you have to send an audit. Then you have to send what is the sex ratio of the children born and things like that. Because it is mandatory, so we are sending it. Now the question arises is these softwares, they fail. They have to be very robust programs. They don't work, they hang. And IVF is not just one entry. IVF is a process which can go on for years together. How will that extensive data be entered? A patient just doesn't enter IVF. The patient goes through multiple cycles, frozen cycles, multiple children through the same cycle, multiple cycles, multiple, attempts and things like that. Will the government make it mandatory? If the government makes it mandatory, I'm sure every 3,000 registered centers in India will have to enter it. But if it is not mandatory and it is voluntary, then very few centers will enter. Why will they do? Because this will require a separate manpower. Believe me, this will require two full-time workers for a high volume center.
Of course.
A center doing more than 50 cases in a month will require two manpower to enter this data, because right now everybody is, worked. They have enough work to do this. Some assistants have to be done.
Ma'am, I'll add to this. Ma'am, you said additional manpower. Ma'am, the data entry operator who does the registration, if he is even 10th or 12th pass also, they can do a normal form entry.
There is no data entry right now. There is no data entry. People come to my clinic, they take my prescription and they go away. Same way.
Ma'am, that is what the change is. That is what the change we are looking for, ma'am. या आपके पास जब कोई आएगा ना मैम, तो आप सीधा बोलेंगे.
It's a government mandate. Why will all the centers enter? See, this mandate has to come, that it is important and mandatory for all centers to enter digitalization. Everybody wants to do digitalization, and like I have a doc point or something, people have their own softwares, own entries. They will say, we are happy, we are retrieving our data through this.
मैम आई नो पीपल हैव से कि फोर्टिस का खुद का एप्लीकेशन है, तो वी आर डायरेक्टली फोर्टिस में हम ट्रीटमेंट लेते हैं, हमें क्या जरूरत है. बट मैम, यू ओनली टेल मी if suppose I want to go for a second opinion to Medanta, so I have to carry my papers.
इंडिया में चाहता ही नहीं डॉक्टर कि मेरा डेटा सेकंड ओपिनियन के लिए जाए। यहाँ
Why
पे
will they want?
लोग डिस्चार्ज पेपर ही नहीं देते, लोग बताते ही नहीं कि आईवीएफ में
Privacy
क्या
of the
हुआ।
data. I mean, I do not know whether it's so easy
No,
to share
it's
it.
a very complex
Ethical issues are there. You
It's a
cannot
very
just.
Ma'am,
complex
when we
issue.
come to ethical and sharing of the record, that's what I said. Ki if I want my data to be visible to other doctor, it's absolutely consent based, right? If I say Apollo is using a product and they want the records to be exchanged between Apollo chains, that can also be done. Chains
या
of
तो
hospitals.
IoT के थ्रू पेशेंट्स आ रहे होते हैं तो इंसेंटिव होता टू सेंटर्स की I have registered in this scheme and I'm getting patients, even if it's a little subsidized, but I'm okay with it. Here, there is no benefit. Government has not made a mandate for centers to enter. It's a very voluntary thing, which I can understand. The
we always
government mandate has to come that you have to get digitalized and you have to put in a central, because it's the need of the hour. It's really the need of the hour that centers should give this data, IVF data. I see my center has been giving a proper data for last 20 years. But are all centers ready to do it, to give their, IVF process? People don't give a simple discharge paper also in India. 90% of centers.
So, guys, Anita and Jitendra, I think I'll have to now move off, go to some other meeting. It was at 5 o'clock.
Sure,
So
sir, sure.
allow me to just move out. You guys can continue because I got
Okay, sir,
other
sure.
engagement.
It's a complex issue. I don't know how it's going to.
Ma'am,
Will 10% centers giving
ma'am,
up
ma'am,
now?
I'll add to this. I'll
Yeah.
say, ma'am, जब किसी भी चीज को किक स्टार्ट कराने के लिए ना उसकी जरूरत को फील कराना बहुत जरूरी हो जाता है. इन शॉर्ट आई विल से मैम, पहले जब ये क्या कहते हैं हमारे मोदी जी ने जब नोटबंदी करवा दी थी, इन शॉर्ट आई विल से हम में से कितने ही पेटीएम को यूज करते थे, बट जैसे हम लोग मुसीबत में फंसे हम सब डिजिटल हो गए. वैसे ही मैम, द डे विल कम. This is just a kickstart of this mission. I know, ma'am, next 5 years or 6 years में this is going to be compulsory automatically. जैसे जैसे इसका सब मैम इसका bandwidth बढ़ेगा, people will realize the benefit of having digital records and sharing and authenticity of the data, security of the data, and in fact it will give the treatment point from the quality of care that they get it. कि यार मेरे सारे रिकॉर्ड्स तो मेरे ओटी होने से पहले ही पूरे हॉस्पिटल ने रिट्राइव कर लिए जस्ट बिकॉज आई हैड आभा आईडी लिंक टू दैट. So that benefit when patient will see, they themselves will.
मोदी जी ने मैंडेटरी कर दिया डिमोनेटाइजेशन, तो लोग
कंपल्सरी करा.
कंपल्सरी
करे कुछ नहीं होगा. और अनीता, patients are coming from IVF centers without any record. I am sure IVF centers are not ready to disclose what treatment they are giving.
है ना, ये आना है तो ये डेटा एंटर करना पड़ेगा, देन ओनली 100.
मैम इसी के लिए तो हमने डॉक्टर तलवार से
सेंटर न्यू
बोला कि सर
डिजिटल, ये तो बहुत इंपॉर्टेंट है. इवन डोनर्स, जो एग डोनर्स है, उनका डेटा नेशनल रजिस्ट्री में आना चाहिए. दैट वंस द डोनर हैज डोनेटेड वंस, वो पूरे इंडिया में कहीं नहीं डोनेट कर पाए. ये कोई तरीका ही नहीं है अभी जानने का यहाँ पे. तो ये मैंडेट लेकर आओ, इट्स वेरी इंपॉर्टेंट कि ये कंपलसरी है इन इंडिया में, जैसे होता है हीफा है इन यूरोप.
That's what I'm saying, ma'am. See, the change has already started. Now it has to just make it compulsory. That and sir has already thought a projection for that. We will involve all the IVF bodies under art, and yes, we have direct associations with ICMR as well. And of course, ma'am, I think so. I mean, when people like you speak about this should be compulsory in IVF, we understand there is an urgent need into it. And of course, when the change has started, ma'am, this will get mandatory, at least for IVF. But ma'am, why ये change start तो करे? Start with the small steps. Of course, ma'am, we will reach the milestone.
Anita, in IVF we are using software. I started using software 20 years back. I was the first person to use the software In fact, we modified the software. The engineer came, sat with us for few days. We modified the software. Finally, it was released, and many other centers picked up the software. So initially, 2 years, he made it free to me. Thereafter,
Okay.
now he say you have to pay every year some money. I say I'm not going to pay. Finish. So what were you saying? You are saying very small amount. The small amount may be 5,000
सर
rupees,
पता है जब
10,000
वो
rupees.
स्मॉल अमाउंट से सर बेनिफिट दिखेगा ना कि अब मेरे 2 साल बाद के पेशेंट्स भी आ रहे हैं, मुझे इसका रिकॉर्ड दिख रहा है, तो कुछ चीजें ऐसी होगी ना यार, जैसे सब्सिडाइज रेट अगर नहीं भी आ रहा तो आएगा, बट तो वो जो बेनिफिट आना जरूरी है सर, कि वो देखेगा कि यार इससे मुझे रिकॉर्ड को लेके ना टेंशन नहीं है,
You see
बंदा
what Dr.
रिकॉर्ड
Sweta has
लेके आए
mentioned.
चाहे ना आए, बट मेरे पास उसका हिस्ट्री है. वी हैव एप्लीकेशंस की वेरी आई
That
कैन सी कि
I agree. But what Dr. Sweta said, until as you government make it mandatory, it is not going to work. It is simply
सर
not
आई
going to work.
यस सर आई
We
एग्री
were
सर, आई
in talk with
एब्सोल्युटली
the
एग्री.
American Society to take up their software to make our own data. It didn't work out because that was going to cost us money. So we didn't go for it. It was the same software they were using. And the other thing is the credibility of the centers here. Like she mentioned, 90% center don't give them discharge paper. And by this data, you are going to say which center is having better results, success result. You understand? That is going to be big point of this thing, controversy, which whether I should give correct data, I should manipulate my data, but
Sir, in Gurgaon, this has already started. We are supposed to give data, the positives, the negatives, how many cases we have done. We're already submitting
we
that.
are also giving. We are also giving. We give data twice in a month.
And anybody can see anybody's center in the portal.
ये जो डाटा बेटे पीएनडीटी को देते हैं ना.
Yes, sir.
ये डाटा पीएनडीटी को देते हैं. पीएनडीटी में अभी ऑनलाइन पता नहीं गुड़गांव में शुरू हुआ कि नहीं, दिल्ली में तो हुआ नहीं है. दिल्ली में वो स्टिल सेंड पेपर में लिख के भेजते हैं. Every month we send by paper. Until the data from all over the country, all over the states, they put on one portal where we can see it. Only then we can understand.
Sir, I think so we should connect on this, because we are working on something like use case specifically for IVF. Then we should think for a use case which can be adopted specifically for IVF, because I can hear certain things that sharing of the report is mandatory, then evaluation, then you are sharing with some other body. So we can connect with the committee members and look for the use case specifically for IVF domain as well.
I totally support what you're saying, Anita. But
yes, sir.
I want to inform you, you must be aware this AIT board, AIT law has been made since 3 years. Till date, they have not been able to make any portal, no online this thing. Although everything when it was made, they said the whole data has to be online. And we don't see maybe the next 5 years it will be online. It is still papers. So if the situation remain like that, who is going to put the electronic medical record online?
Sir,
you have to motivate. Either the government make it mandatory. You understand?
It's online means I can say the record which is being generated is digitally saved in your, in your application or the product which you are using it, so that it is interoperability of the data becomes easy. It's not like, online anywhere, anybody can view that. Right, sir? But yes, वो digitize होने के लिए भी we have to make some compulsion that yes, आपका पूरा जो treatment है वो digitize way में ही होना चाहिए rather than going on paper based. That I agree.
And let's hope we have more further discussion and
yes, sure, sir. We have formed a group for overall, regular interactions. And yes, during my sessions, sir, I introduced that to enter into ABDM, we could request all the professionals to please register themselves in the NHPR portal as a national professional registry, health registry, wherein I think so. I have, yes, sir. I will just put this put this link in the chat box. I'll request everyone to please go and spend at least 5 minutes on this. And next time when you register yourself, please register yourself into NHPR and do let us know that you have completed your registration.
Right.
Thank you so much for, the lovely messages just now I have seen. Thank you so much for this initiative. But yes, this initiative is just a start. We want your support, to enter your ecosystem, that we can also say that from IFS, we have these many professionals registered in our ecosystem and they are keen to get digitized as well. And we will be in touch with a senior person from this group and, to make the entire clinic digitized actually, not only just on the webinars. And thank you so much, Dr. Nair. Your insights were really, helpful, and Shweta ma'am as well.
Thank you, Anita. Thank you, Jitendra.
You're welcome, sir.
Goodbye.
Thank you, sir. Thank you.
Thank you.
So much.
Okay, bye-bye, everyone.
Bye.
Thank you for joining the meeting. And Mr. Jitendra and Ms. Anita, we'll get back to you. And we will see how this program can be successful.
Yeah, ma'am, one thing, while doing the registration, all the participants, those who have joined this must have enrolled themselves in that one form, right? So that access, you must be having the list of all the participants.
Today's participants?
Yeah.
Yes, we have that.
Yeah, can you just share only the participant's name, ma'am? We don't want any PI data of like mobile number or anything, but yes, participants' names.
Let me just find out if we are allowed to do that. Then I will definitely.
You can check, ma'am, because ma'am, we just want to keep a track that, we are targeting to cover maximum webinars and we will just keep track, how many have
No,
joined.
about
and,
27 of us today, including both of you.
Yeah, I saw the number going, I think so, 30 or 32 as well.
Okay.
Right, ma'am. So just we want to keep a track, every webinars, how many professionals are getting awareness, because ma'am, awareness is also one of the key success of ABDM adoption.
Perfect. I think we can have a consent form or something that the participants, if they, because see, you are understanding it's a sensitive matter we are dealing with.
Yeah. Ma'am, only the, that's why I
digitalization
said
and
only
data
the
sharing of
participant's
IVF.
name, not any
So
PI data.
Yeah, sure. Okay.
Yeah.
Thank you.
Yeah. Sure, ma'am. Thank you so much. Thank you, everyone. Thank you so much for joining.
Okay, thank you.